Hello, everybody. My name is Golnaz Nouri. I'm a board certified physical medicine and rehabilitation physician, as well as the medical director of the acute inpatient rehab unit at Southern Indiana Rehab Hospital, or CARH. Today, I just wanted to hop on and talk to you about how being CARF accredited sets us apart from other facilities and talk to you about some of our stroke success stories that we've had recently. At CARH, we are CARF certified, which stands for Commission of Accreditation of Rehab Facilities in 3 specialties: stroke, brain injury, and general rehab. In order to get this accreditation, we went through a very rigorous peer-reviewed process by surveys on site. And we demonstrated that our programs and services are accountable, measurable, and of the highest quality. Our participation and adherence to CARF standards mean that our acute inpatient hospital is dedicated to continuous improvement by examining patient health outcomes and surveying patients about their experiences. It also validates the quality of our care and services, including employing qualified professional physicians, therapists, nurses, case managers, and psychologists. It also says that we're personalizing care plans to fit the needs of each patient, as well as providing patient-centered care, including prompt response to patient needs and questions. Now, I just wanted to talk to you about some of our stroke success stories that we've had. I just wanted to give a little bit background beforehand and say that every stroke is different, and how a stroke affects a patient is different. Some people have long-lasting effects after a stroke, and some people have no long-lasting effects after a stroke. Some of the factors that affect prognosis after a stroke include the location of the stroke in the brain, the severity of the stroke when it happens, the age of the patient when they have the stroke, their comorbidities, the other medical conditions that they have, and also how soon they got treatment after a stroke. Sometimes they can give a very strong blood thinner to break up the clot in the brain if that was causing the stroke within 4.5 hours after the symptoms start. After the stroke, the first few months are very important because the most functional improvement happens in the first 3 to 6 months after a stroke. Patients can still have functional improvement within a year or 2 years after the stroke, but those first few months are very critical, and that's where the most progress happens. That's why we really emphasize to patients to get into an acute inpatient rehab facility like ours soon after they're medically stable, so they can receive the most intense therapy you can receive anywhere, which includes a couple hours of therapy per day. Then after they've completed their acute inpatient rehab stay, we recommend our patients to go to our outpatient rehab clinic, where they continue their therapies over there and they receive a few hours of therapy per week. When our therapists meet our patients, they really work on one-on-one with them to come up with a personalized care plan and come up with the patient's top 3 goals for their functional goals when they are discharged from here. That could vary amongst, again, what is important for any patient. Some of them could say they want to walk. One person could say they want to swallow. One person, their goal may be to just pick up a spoon and bring it to their mouth. So it's different for every patient, and we really consider that into our care plans. Now I just wanted to talk to you about a few patients that come into mind. So recently we had a 40-something-year-old male who had a very severe stroke that caused flaccid paralysis of the right side of his body, which was his dominant side. And before this, he was working full-time, very independent, driving. So it was a very huge change for him. And when he got to our hospital, he wasn't able to walk or take care of himself at all. By the time he was discharged, with the help of our therapist, he was able to walk as he gained some function in his leg, and with the help of an AFO, which is a brace, ankle brace. And he moved on to go to our outpatient rehab clinic, where he's still there, and his goal is to go back to work and hopefully driving one day. Another patient that comes to mind is a 60-something-year-old male who had a very severe stroke and very complicated hospital course before he came to us. He required a tracheostomy at the hospital, so a breathing tube in his throat, in his neck, as well as a PEG tube, which is a nutrition tube in the stomach, because he had such severe swallowing difficulties from his stroke. And it was dangerous for him to eat because of the swallowing issues. So by the time he was discharged after a few weeks, he was able to walk as well as do most of his self-care. Whereas when he got to us, he was not even able to sit on the edge of the bed independently. So he had very huge improvement, which was very amazing to see. The last patient that I wanted to talk to you about is a 90-something-year-old that was actually recently discharged. He came to our hospital after having a stroke that affected the language center in his brain. So he wasn't able to express himself at all. He wasn't even able to produce any words to express himself. But he was able to mostly understand what we were telling him. So with the help of our speech therapist and occupational therapist, they came up with a communication board that was personalized for him, so he would be able to communicate his wants and needs to other people. He eventually discharged to an assisted living back to the community, which again was very amazing to see. Thank you for watching this, and we'll see you guys later.